Thank you, guys. Okay, so some bad news and good news. Bad news, I don't think there's a fountain of youth. And unfortunately, we all get older, and the aging process does not leave our skin behind. Good news, though, there are some ways we can slow down the aging process and even reverse it. Today, we're talking about facelifts. Dr. Christopher Park from Mobile Plastic and Reconstructive Surgery and Dermatology answers some questions about the surgery and about the results. We all want to look our best, and one thing that everybody sees is your face. So today we're with Dr. Park, and we're going to be talking about facial reconstruction. Thanks for having us again. Okay, there's so many things that fall under this category. First of all, the facelift. I mean, that seems to be what everybody thinks about when you think facial reconstruction, but there's more to it.
Yeah, I mean, facial rejuvenation can include a lot or little, and it depends. And a lot of people feel like it's this huge step to come see the plastic surgeon and consider facial rejuvenation. A lot of that is going out the window. I mean, back in the 70s and 80s, facelifts used to mean you went in when you were 65 years old, maybe 60, and had a bunch of skin removed and were just pulled really, really tight. And you didn't look very natural, and you kind of looked a little different.
Right.
And you know, yes, it made you look younger, but a lot of people were scared of it. That's not where we are. And a lot of that revolution came around with all the minimally invasive alternatives we have. You know, it starts with Botox and fillers and lasers and peels, and it kind of changed the way of thinking. And we've gone with facial rejuvenation almost to a more preventive or maintenance phase rather than this drastic revolution and changing the way the face looks. So oftentimes now when I'm seeing a patient for facial rejuvenation, we may not be talking about doing a bunch of things. We may just be doing a short scar facelift, you know, tightening up the cheeks and the jowls and getting the neck a little bit tighter with just a short scar. And sometimes we're able even to do the neck and the jowls with just liposuction alone, with just a 3 to 4 millimeter incision. So, I mean, it may range from anything from liposuction to a short scar technique where we're able to lift up the face to doing everything. And when we do a pan facial rejuvenation, which if you wait long enough, that's what I'm going to recommend, and you kind of have to address every part of the face or something's not going to match. So in some patients, when they come in for a facelift, yes, we end up talking about a brow lift, upper eyelids, lower eyelids, the mid-face, where all these structures start to fall down, those can be lifted, the face itself, the lower face, the neck, around the mouth. Sometimes we even have to lift a droopy chin or put a chin implant in. And sometimes, if you wait long enough, the nose, even if you've always liked your nose, as you get older, it's going to start to droop and stick down. And so sometimes we're doing 9 or 10 things at one time. But in this era, in my personal preference, is to not wait that long. I mean, don't have this huge operation. If there's some things we can do along the way to keep you looking like yourself, and then you don't have to have this drastic change in appearance. Speaking
of, you mentioned Botox and fillers. Do you believe that if you start Botox and fillers early enough that maybe you won't have to have a complete reconstruction later in life?
I think it delays it. I mean, it's not going to prevent it.
Right.
But certainly with the combination of Botox and fillers, you're not allowing those wrinkles and folds to get as fixed where they are. And just the simple act of going in and doing fillers, more so than Botox, by going in with needles and using fillers, you're creating a little bit of scar tissue. Now, not the bad kind of scar tissue, good scar tissue, that causes collagen to rebuild, which decreases. I mean, that's one of the things that happens as we age. You lose collagen, you lose elastin, so you lose the tone of your skin. There's a technique out there, not too many people do it, called needling, where people just go in with needles in the face and just try to create scar tissue.
Wow, I haven't heard about that either. So this day and age, we're learning more about the needling, like we just learned about, also learning about the fillers. How old do you think, or how young do you need to be before you start thinking about keeping your skin young and your appearance?
If you talk about the whole spectrum of facial rejuvenation, I mean, anybody over 30 can start using Botox, and fillers are going to need about the age of 35, and then, you know, you may want to start doing your eyes or your lower face or just your neck at 40 or 45. I mean, there's no reason to wait till you're 55 or 60 anymore, because With the revolution in techniques, we're using less aggressive, which means safer and less recovery techniques to, again, try to maintain where you appear rather than waiting till you're 60 and trying to turn the clock back to 45.
Fix it. Exactly. All right, so if you're watching, don't put it off anymore. If you have been, now is the time to really start thinking about taking care of your face and your skin. And that way, maybe you can prevent the aging process happening so quickly, right?
Absolutely.
Thank you so much, Dr. Park.
Thank you.
Now, if you're thinking about having any type of cosmetic surgery, be sure you talk with an experienced plastic surgeon before you make any major decisions. If you would like to set up a consultation with Dr. Park, you'll find his contact information under the Studio 10 tab on fox10tv.com.